By the end of this video, you'll understand how Medicare Supplement Plan N works, whether or not this is the perfect plan for your healthcare needs, and how Medicare Supplement Plan N can potentially help you save big on premiums. So let's dive in. Medicare Supplement Plan N is one of the 10 standardized Medigap plans. Medigap and Medicare Supplement Insurance mean the same thing, designed to work alongside Medicare Parts A and B. Plan N helps to cover some of the deductibles, co-insurance, and co-payments that traditional Medicare Parts A and B just doesn't cover. But unlike some of the other Medigap plans, Plan N has some unique benefits that can make it more affordable for people that don't mind paying a little bit more out of pocket when they go to the doctor and hospital. So by looking at the chart here, you can see that Medicare Supplement Plan N covers the Part A co-insurance and hospital costs. The 20% Part B co-insurance is fully covered, except for a small copayment, which we'll review in a moment. Covers the first 3 pints of blood you might need for a transfusion, Part A hospice care co-insurance, skilled nursing facility co-insurance, and foreign travel emergency care are all covered by Medicare Supplement Plan N. So how does Plan N work in practice? Well, it's a pretty simple setup. You pay the first $257 per year of your medical expenses. That's your Part B deductible. That's the amount that you have to pay first before Medicare and your Medicare Supplement Plan kick in. Most Medicare Supplement plans do not cover that deductible. So you pay that first $257 per year. And then after that, Medicare pays 80% of your medical bills and Plan N pays most of the other 20%. However, there is a catch. Plan N does require a small copayment of up to $20 for certain office visits or up to a $50 copay for an emergency room visit. Now, that copay for the ER is waived if you get admitted to the hospital. And the $20 copay for office visits isn't for every office visit. It's for office visits that fall into certain diagnostic codes. Essentially, the types of doctor's office visits that will trigger this $20 copay on a Plan N are evaluation and management type of office visits. So this could be a sick visit like the flu, injury, mild illness. This could be a specialist office visit, potentially follow-up doctor's visits after hospital discharge, or office visits that are managing chronic conditions. Those could all be subject to that $20 copay with Plan N. Where you would not pay that $20 copay is for preventative care visits. You wouldn't pay it for hospital inpatient services, and you wouldn't pay it for certain lab work or diagnostic testing. Those are usually covered separately under Medicare Part B. So if you're comfortable paying small copays, then Plan N could be a fantastic option for you. Just like any other Medigap plan, Plan N has no network, so you can always choose your own doctors and hospitals. You don't need referrals to see a specialist. Many people considering Plan N want to know more about the pros and cons of this plan, so that's what I'll dive into next. Let's take a look at these so you can decide if this plan is right for you. First, some of the pros of Plan N. The first pro is lower premiums. So Plan N typically always has lower premiums than its slightly more comprehensive counterparts like Plan G or Plan F. This could save you money every month, and when you compare it specifically to its most popular counterpart, Plan G, the savings could be very significant over the life of your policy. Additionally, Plan N is one of the only Medigap plans that is not a protected guaranteed issue right plan. Now, I'm not going to get too much in depth into that topic in this video. I have linked a video below that goes into more depth about guaranteed issue rights and how those can impact your plan's future rate increases. But the big takeaway is that in general, it's a safe bet to assume that over the life of your policy, Plan N is likely going to see lower rate increases than, say, Plan G. And Plan N costs less than Plan G usually initially. So when you compound these rate increase differences over time, you can see that there could potentially be a big savings on Medicare Supplement Plan N over time compared to the popular and very similar Plan G. Another pro of this plan is comprehensive coverage. So like I mentioned before, this plan fills in almost all of the gaps in traditional Medicare Parts A and B. So you're not left with huge out-of-pocket responsibilities if you, God forbid, land in the hospital, get cancer, or get a major chronic illness. This plan also offers reliable coverage. So Plan N, just like all Medigap plans, are standardized across the US. They offer the same reliable benefits no matter where you travel, no matter where you live. Your Plan N goes with you. It works the same way no matter where you are. And because there's no networks, any doctor who accepts traditional Medicare will always accept your Medicare Supplement Plan N. No matter what insurance company it's with, doctors and hospitals that accept Medicare must accept your Medicare Supplement Plan. Now let's get into some of the cons of Plan N. The first con that we already mentioned is the copays. So on Plan N, you do have those doctor's office visit copays, potential copays for a standalone emergency room visit as well. If you're someone who visits the doctor very frequently, those copays could add up and potentially make Plan N not worth it for you. Another con to mention is that Plan N does not cover Medicare Part B excess charges. So some doctors will accept Medicare patients, but they won't sign on to be a Medicare participating provider, meaning they don't accept Medicare assignment. That means they don't accept Medicare's payment as payment in full. In this instance, that doctor could potentially bill you up to 15% above the Medicare approved amount. This is called a Medicare Part B excess charge, and it's not covered by Plan N. Now, this is quite rare. Data shows that 99% of Medicare claims are billed on assignment, meaning there are no excess charges on the vast majority of Medicare claims. So I don't consider this a big con or negative about Medicare Supplement Plan N, but it's definitely something to consider. Now, a lot of people will say, yes, excess charges are now very rare, but who's to say they couldn't be more prevalent in the future? That's true. I guess we don't have a crystal ball. We don't know what the future holds, but as it stands, doctors are not very incentivized to charge these excess charges, meaning they're not very incentivized to accept Medicare patients, but then balance bill above the Medicare approved amount. It becomes a hassle for them. They don't get that full 15%, and it's usually not worth the extra payout based on what we've heard and seen. Now, I do have another video that's all about Medicare Part B excess charges. It goes into more depth about how these work, and it shows you how to find out whether or not your doctor accepts Medicare assignment, accepts Medicare as payment in full. Because if they do, then they just can't bill you any excess charges. They can never balance bill you. There's a way to search on the government Medicare website, again, linked in the video description below. And you'll find that when you're searching online, it's very rare to find a doctor that doesn't accept Medicare's payment as payment in full. So who should consider getting a Medicare Supplement Plan N and who shouldn't? So if you're someone that's relatively healthy, you don't visit the doctor all the time, and you prefer a lower monthly premium, then Plan N just might be the perfect plan for you. This plan is ideal for people that don't mind paying a small copay when they go to the doctor's office, and people who want reliable coverage that can travel with them, and those who don't want to deal with any network, doctors being in and out of network or needing referrals to see a specialist. If you're someone that very regularly sees doctors and specialists, it might be more beneficial for you to consider Medicare Supplement Plan G, because on a Plan G, you don't pay any copays for office visits. And depending on where you live, in some areas, Medicare Supplement Plan G and Plan N are priced very similarly. So if you're someone who lives in an area where Plan G is only $10, $15, $20 a month more than Plan N, and you see the doctor frequently, then in that situation, you might want to look more into Plan G and how to choose the right insurance company to make sure that those rate increases don't hit you down the road. So if you're considering Medicare Supplement Plan N, timing is key. The best time to enroll in a Medicare supplement plan is when you are brand new to Medicare, meaning you are new to Medicare Part B. When you are, you get a one-time 6-month open enrollment window where you can choose any Medicare supplement plan with any insurance company, and you will automatically be approved at the preferred rate. After that window closes, you could potentially be denied Medicare supplement insurance, or you could be charged a much higher rate. So that's definitely the best time to enroll in a Medicare supplement plan, Plan N or any Medigap plan. Now, you can apply for Medicare supplement insurance at any time during the year, but keep in mind that in most states, you could be asked medical questions when you're outside of that 6-month window. And based on your health history or your current health, the insurance company could deny your application for coverage, or they could charge you a higher premium. Now, there's a few states, the ones listed here, where Medicare supplement insurance is never medically underwritten, but in most all other states, it will be when you are outside of that 6-month Medigap open enrollment. So there you have it. Medicare Supplement Plan N is one of my favorite options. It offers very comprehensive coverage at a lower premium with typically lower rate increases over time. It's perfect for people that want very reliable, comprehensive coverage without breaking the bank. So as long as you don't mind those small co-pays, this is definitely one to consider. Now, there are many different insurance companies that offer Medigap Plan N, and the pricing for Plan N is going to vary a lot based on where you live and what insurance company you go with. Also, your rate increases are going to vary based on which insurance company you choose. So it's just as important, if not more important, than choosing which plan letter you want for your Medicare supplement as which insurance company you want to go with. So that's where we can help. In my office, we are licensed with over 30 different insurance companies. We work in most all states, and we can help you determine which plan is the best for your needs, which insurance company is going to be the best bet for you, and we can answer any questions you may have as well. Please don't hesitate to give us a call. We'd love the opportunity to help, and our service is completely free of charge. Thank you so much for watching. Please leave any questions and comments you have for me in the video description below. Like this video, subscribe if you haven't done so yet, and thanks again for being here. We'll see you soon.